A recent study shows 9.5% of Salina County residents live with diabetes. Leslie Mack from Salina Regional Endocrinology comes on the Pulse today to discuss diabetes. Leslie, you work for Dr. Richard Gomendoza, who is an endocrinologist. I think that's a good place to start. Exactly what is an endocrinologist?
Good question. An endocrinologist is a physician who specializes in diseases of the endocrine system. So that would include all the glands that we have in our bodies, glands that secrete hormones, such as thyroid hormone or adrenaline, for example. And so if you have a problem with the pituitary gland or the thyroid, parathyroid gland, the adrenal glands, the pancreas, of course, which secretes insulin, it's those types of diseases. That's what they specialize in.
Which one of those is diabetes, which I understand diabetes is where you specialize in as far as with the diabetes patients. So first of all, what is diabetes, I guess?
Well, basically diabetes is a disease of metabolism. And so when someone has diabetes, their body is having a hard time using the food that they eat for fuel. And that's really all it boils down to. Our job is to figure out what that problem is, what that defect is, and correct that defect. And that's it.
So your role is actually helping the patients maintain their diabetes. How do you do that?
I do that by working with the patient one-on-one to sort of figure out what they understand the disease to be, and then work to dispel some of the myths. Like a lot of people have a lot of misinformation about diabetes, and so we go over that and talk about what is really going on in the body. Then we use different medications or different tools to manage the disease so that you can go on and live a healthy life without developing any complications from the disease itself.
I know one thing when we were talking beforehand that you were really excited about is some new technology. Maybe not new technology, but they've just kind of improved some of that in the glucose monitoring and the insulin pumps, correct?
Yeah, you got it.
Well, why don't you talk about that?
An insulin pump is like the Cadillac Escalade of all diabetes treatments. And so it's really the top of the line treatment for diabetes. And so the new insulin pumps are really kind of cool, the technology that's available. For example, one pump will work with a continuous glucose monitor. And so if your blood sugar starts to climb up, the pump will automatically give you a little bit of extra insulin. If your blood sugar starts to go down, it'll decrease the insulin. And it keeps you just real steady, like 170 all the time, 140 to 170. It's really amazing.
So that means, self-monitoring is no more finger sticks on those, correct?
We don't have to do the finger sticks in some circumstances. With that system I just described, we do have to do some calibration readings during the day. But there are continuous glucose monitors available for people that don't use an insulin pump, for example, that you can just wear, and you want to know what your blood sugar is, you just look at your phone and there it is.
If somebody wants to see either Dr. Gomendoza or yourself at the Salina Regional Endocrinology, how do they go about doing that?
Well, the best thing to do would be to talk to your primary care provider and see if you can get a referral. We also take patients without a referral, but it helps us if we do have that referral. We get a little bit of background information from your past medical history and your records from your provider, so that's probably the best way to go.
Thank you for watching The Pulse. For more information on today's topic, please visit salinaregionalendocrinology.com.